Viyo Recuperation is a highly palatable liquid nutraceutical designed by veterinarians to provide a complete balance of essential nutrients to address metabolic changes and improve the health of cats and dogs suffering from severe illness or recovering from anesthesia or surgery.
So I first heard about Viyo when a friend of mine, he's a veterinary nutritionist at Texas A&M University, told me about this product, and he told me what the ingredients were, and we kind of discussed, the potential benefits for the gastrointestinal tract and the potential for this being something that would be very beneficial for recovery for some of our patients. We have a saying that if the gut works, you should use it. And intravenous nutrition is, one, very expensive, has lots of complications, and you need nutrients in your gastrointestinal tract for it to remain functional and to work properly. We know that there are a lot of changes that happen with a patient not getting adequate nutrition. Some of those changes are changes associated with the gastrointestinal tract, which I'm very, very interested in. My specialty is GI disease. And we know that the intestinal tract will atrophy, or the cells get very small and shrunken. They don't work as well. That the intestine becomes very leaky, and bacteria and toxins can get through the intestinal tract. So good intestinal integrity is very important.
Viyo Recuperation can be used to help correct a number of the metabolic deficiencies that occur due to a variety of different inflammatory and gastrointestinal diseases. We frequently say it's actually better to feed the gut than anything else when it comes to recuperating from chronic illness or acute insults that might have a chronic sequela. The body needs nutrition to heal itself, and having that given in a palatable way that the animals will eat on their own also makes it easy for the practitioners. And certainly hydration via the mouth is extremely important, because if you have to be on IV fluids, you're still in the hospital.
A key requirement for an oral nutritional supplement is that it be readily accepted by patients. Studies at Colorado State University are assessing Viyo Recuperation in specific patient populations, looking in particular at palatability.
We just completed a study with cases of parvovirus, and these were young puppies that came in, and it was actually part of a larger study looking at antiemetic therapy, and we treated these patients for their parvovirus, and then at the time of release from the hospital, they were given either a placebo or the Viyo. And these animals, then the owners were to monitor these patients for 10 days following recovery at home. It was very well accepted as far as palatability. We started out with the Viyo and then as a top dressing on the food. Palatability was great. The first day, the stool character was much better in the parvo cases. So we are actually now doing another study, which we will be starting very shortly as the parvo season begins, where these animals will be given either a placebo or the Viyo at the time of hospitalization.
One of the biggest problems that we have in small animal veterinary internal medicine is chronic kidney disease in cats, because those guys really are off their food, but they need electrolytes, they need amino acids, they need the fluid parts of liquid diets. We've developed a two-phase study to look at Viyo Recuperation in the recovery phase of cats with chronic renal disease. One of the first things we wanted to do, and that made the first experiment, was to see how palatable it is to cats that would have borderline appetites because of their chronic kidney disease. Those that we've offered for the 14-day study have willingly ingested all the volume that we've given with no adverse events noted physically or on blood work, looking at kidney tests, electrolytes, phosphorus levels. At this intermediate stage of the study, I think my research group is going to consider it to be extremely palatable for cats in chronic stable renal failure. We want to be able to get cats back on their feet more quickly when they have an exacerbation One of the biggest problems we have in that stage of these cats is they're a little bit nauseous, they're a little bit slow on the uptake for drinking, and their kidney tests go zooming up, their phosphorus levels go extremely high, they become dehydrated. It seems like within minutes after stopping eating and drinking. So our hypothesis is that cats offered via recuperation will actually drink and take in nutrients faster than cats that are treated just with fluid therapy and oral water.
Nutrient-dense but low in calories, Viyo Recuperation is a complete formulation that includes vitamins, minerals, amino acids, and fatty acids. In addition to important nutrients for healing, Viyo Recuperation includes the prebiotic fibers inulin and fructo-oligosaccharides to aid digestion and improve nutrient absorption.
One of the interesting things about the Viyo is that it does contain a number of amino acids, as well as omega fatty acids and some vitamins, minerals, and prebiotics. And the one particular is a fructo-oligosaccharide, which changes the GI flora and the type of bacteria to promote good bacteria growth. And then also of importance is glutamine for in gastrointestinal tract integrity. And when we ever have any animal that has any GI disease or is not eating, we really want to make sure that we can get adequate glutamine into those patients.
And so in the spectrum of diseases that I'm involved with as an internist, I want the hydration status to be improved quickly, and I want to feed the gut quickly. The substances I want to use have to be palatable, and they have to be complete.
Recovery from illness or surgery can take 2 weeks or more, so it's recommended that Viyo be given for 14 consecutive days. In the veterinary clinic, there are 3 primary areas in which Viyo Recuperation is used: following surgery, in animals that are weak and debilitated, and to boost the health of kittens and puppies. But the uses of Viyo Recuperation are expanding to include other conditions in which patients are stressed or immunosuppressed.
It has been used by our oncology service for many of our animals that have cancer. And some of my GI patients, as well as some of my patients that are recovering from pancreatitis, we know that it's very important to get nutrition in your patients that have pancreatitis, and that intestinal integrity is also very important. And so I think this is a good adjunct part of the therapy for some of those patients as well.
Colorado State University Veterinary Teaching Hospital is staffed by every known specialist in the veterinary profession, so we have opportunities now to use Viyo Recuperation to help aid in the recovery of many different diseases in cats and in dogs. And so, yes, I believe we'll be having many of our different specialty groups evaluating Viyo Recuperation and the clinical recovery of their patients.
For more information about Viyo Recuperation, please visit our website at www.viyorecuperation.com.